there are at least 113 different cannabinoids. So in our bodies, just like we have opioid receptors, we have cannabinoid receptors in our central nervous system and in our peripheral nerves. And again, these compounds are involved in a lot of different physiologic and cognitive processes. And we have our own internal, what we call endocannabinoids, so our own internal cannabinoids, just like there are internal opiates. We also have the phytocannabinoids, so phyto means it comes from a plant, so that's like what's in marijuana. And then there are actually synthetic cannabinoids. So the two main cannabinoids that are used medicinally. So in medicine, we tend to try to pull out individual compounds. Giving you something that has 113 compounds and we're not sure what they're doing is kind of messy when doctors think about it. So we've tried to pull out individual compounds. So tetrahydrocannabinol, or THC, that's what makes people high. And then the other one that you're hearing a lot about lately is cannabidiol, or CBD, okay? And that doesn't make people high, but it does have some effects of perhaps some pain mitigating effects and also just making people less anxious. Now, one of the things that I learned, because I didn't know a lot about this actually, was that there's a huge variability in the level of these different 113 cannabinoids between different subspecies of marijuana. So apparently there are a bunch of subspecies of marijuana. And if you go to states where they have medicinal marijuana dispensaries, the growers have actually done a lot of work to select out cultivars that have particular effects. So when you see on TV that, you know, at the dispensary they'll have, you know, this particular type of marijuana that does this and this particular type of marijuana that does that, they actually have like tried to select out for these different effects. So there's a huge variability, and I think that's one of the things that is a little problematic about separating out two compounds from a very complex mix of compounds. When we say that a compound works or doesn't work, I don't know what that means for does marijuana work. And we really can't study marijuana because despite the fact that various states have made marijuana legal either recreationally or at least medicinally, marijuana is still illegal in the United States, according to the federal government. And so the studies that have been done have really been done on these specific compounds. And that's really important to understand.